Alright, so the first thing I'm going to do is ask you guys a question, right? So first of all, what are bacteriophages? You have to give me no like complicated answer, just a simple answer is fine.
Viruses that infect bacteria.
Yeah, it's a virus that infects bacteria, right? So can somebody give me the 4 ways by which bacteria exchange genetic information?
Transformation,
Yes.
transduction,
Mm-hmm.
and the C word, conduction,
Conjugation.
conjugation, and transpooning,
Trans
transpoon,
transposon.
yeah, transposon.
Alright. So that's that for that, right? So to jump into this. Before we go to strep, I just wanted to go through how we differentiate strep from staph. Right? So both strep and staph are gram-positive, we know this. And they're both cocci and they're both directly responsible for a wide variety of clinical diseases. So in practice, we differentiate between the two organisms in order to prescribe the right antibiotics, right? And the reason why we do this primarily is because obviously some drugs will work against strep and some drugs won't work against strep, and some drugs will work against staph that won't work against strep, and vice versa, right? So one of the main differences between strep and staph, strep is like a strip of like you could think of it like a pearl necklace, right? It's like a strip of small round balls going down, and staph is a cluster of balls. And then another thing so that differentiates them is strep is catalase negative. So there's an enzyme called catalase, and strep does not have catalase, whereas staph has catalase. So this picture is kind of to remind you of staph. So you have a staff of people that are clustered together, and you have two cats that are present, which represent the catalase. Right? So catalase positive bacteria have the enzyme catalase that converts hydrogen peroxide into water and oxygen. So how we test for catalase? So how we test if strep versus staph? We take a sample of it, of whatever bacteria it is. We don't know what it is yet. We rub a wire loop across it and mix it on a slide with hydrogen peroxide. So if bubbles appear and catalase is present, we know that it's staph. If there's no bubbles, we know it's probably strep or something else, right? So Streptococcus. So the first thing is how we classify strep. So strep is classified by the ability to lyse red blood cells, to do hemolysis, right? So we have three different types of categories for the hemolytic ability. So we have beta hemolytic, alpha hemolytic, and gamma hemolytic. And in that order of intensity, right? So beta hemolytic completely breaks down red blood cells. Alpha hemolytic only partially breaks down red blood cells and leaves the green biliverdin and the blood culture. Gamma hemolytics does not lyse red blood cells at all. So you can think of gamma hemolytics like as a non-hemolytic, right? Because it doesn't lyse red blood cells. So that's one way we classify strep, is by the ability to lyse red blood cells. The other way we classify strep is by what's called the Lancefield antigens. So strep is also classified based on the antigenic characteristics of the C carbohydrate found in the cell wall of strep. Strep, not step. These antigens are called Lancefield antigens, and they go from A to S, but you don't need to know all of the A to S Lancefield antigen bacteria, because only A, B, and D are important, because these are the only ones known to cause disease in humans. So there are 5 categories of strep that cause disease in humans that we will need to know as doctors, right? So the most important, the first one is Strep Pyogenes. So just one more time for a graph. So there's just two ways to classify strep. So one is by the ability to lyse red blood cells, and the other is by the Lancefield antigen. And you only need to know A, B, and D. The rest of them is not important. So we have Strep Pyogenes, also known as Group A. Group A being that it has the Lancefield A antigen. Beta hemolytic, meaning by it completely lyses red blood cells. Streptococcus Pyogenes. And strep is chain, coccus means round, pyo means pus, and genes means forming. So it's some round chain bacteria that form pus, and that's why it's called Strep Pyogenes. Alright, so and they possess the Lancefield group A antigen and completely lyse red blood cells when placed on blood agar. So this is just to show you how this might look. So on blood agar, complete hemolysis, it breaks down hemoglobin into, I forget what's the yellow particle called again, the metabolite that's yellow. But whatever, it doesn't matter. It breaks it down. Yeah, bilirubin, I'm an idiot. Bilirubin. Yes, so it breaks down hemoglobin into bilirubin. That's why you're seeing this yellow streak here, right? Bilirubin, right? Alright, so strep pyogenes can cause 4 diseases. That's not true. It can cause 6 diseases in total. I didn't list the other ones. But you need to remember strep throat, scarlet fever, rheumatic fever, and post-streptococcal glomerulonephritis. So I'll go through the virulence factors of strep pyogenes. So strep pyogenes has a C carbohydrate, as I mentioned earlier, and it has the group A C carbohydrate. So this doesn't have any clinical relevance other than identification. It also has an M protein, and this is the major virulence factor for group A strep. It attaches to the skin and pharyngeal mucosa. It inhibits activation of complement and protects the organism from phagocytosis. Also, it's a weak point because our immune cells can generate antibodies to target the M protein to help opsonize and to help phagocytose strep pyogenes, right? So it's like a double-edged sword. It helps it to prevent phagocytosis, but it also eventually leads to phagocytosis as well. Okay, we're just showing you how it might look. You have a polysaccharide layer, lipotecoic acid. You don't need to worry about this right now. We'll get into this later. Streptococcus fibronectin binding protein is help it. I'm guessing this is to help it to bind to surfaces. M protein also helps it to adhere to surfaces as well. Okay, so these are the more tame virulence factors. These are the more violent virulence factors. So we have what's called hemolysin, also known as streptolysin, and you have two types. You have O and S. So O is oxygen labile, which means it's inactivated by oxygen, and hemolysin, lives up to its name. It destroys red blood cells. It also destroys white blood cells, and it gives the strep pyogenes the ability, the beta hemolytic abilities to completely lyse red blood cells. Something also to note. So your body, your immune cells will develop anti-streptolysin or antibodies after infection. So this can be a marker that you can use to test if a patient had a strep pyogenes infection prior. So you also have streptolycin S, which is basically the same thing as streptolycin O. The only difference is that the body cannot produce antibodies against streptolycin S, only against O. Right. I want to go through this after I go through this. Right. So we have another virulence factor, which is the pyrogenic exotoxin. And something to note, is found in some strains, but not all strains. And it gives Strep Pyogenes more stronger virulence, right? So it can cause scarlet fever and toxic shock syndrome, which we'll get into later. It directly stimulates T cells to produce inflammatory cytokines such as interleukin-1 and tumor necrosis factor. I want to get back up to this. So this is our Strep Pyogenes, and this is the white blood cell, and these are the exotoxins. So there's 3 types of exotoxins actually, and A and C can bind to the class 2 MHC factor in white blood cells and kind of immobilize them, or it can stimulate them. So it can stimulate the T cell population to cause what's called a cytokine storm, which would bring about the toxic shock syndrome. And then, when you reach toxic shock syndrome, you can get into like basically septic shock, right? So widespread systemic vasodilation and all of that good stuff. And the patient would be like on the verge of death, basically. So next virulence factors is streptokinase, which activates a proteolytic enzyme fibrin, which breaks up fibrin blood clots. So streptokinase is basically making it so your body cannot coagulate blood. So this could put you at risk for hypovolemia, right? Or excess blood loss. Okay, we also have hyaluronidase, which breaks down proteoglycans. You have an enzyme DNase, which hydrolyzes DNA. NADase hydrolyzes NAD. And you also have an enzyme anti-C5a peptidase, which disrupts the complement C5a. And by disrupting C5a, you end up disrupting opsonization. So there's another way for the Strep Pyogenes to escape phagocytosis. Another picture, or I did picture it twice. Okay. Yeah, so this is showing the hyaluronidase, so this is showing hyaluronic acid. A local infection causing the bacteria to get into the bloodstream, and streptolysin causing hemolysis. And just up here to note briefly that Staph aureus and Strep Pyogenes have similar enzymes. So by studying Strep Pyogenes, you're kind of studying Staph a little bit because they're very similar in how they attack the body. So what diseases does Strep Pyogenes cause? So 4 diseases are caused by Strep Pyogenes, and 2 delayed antibody-mediated diseases are caused by Strep Pyogenes. So 6 diseases are caused by Strep Pyogenes in total, right? So the 4 diseases are strep pharyngitis, which is like strep throat, streptococcal skin infections, scarlet fever, and toxic shock syndrome. And then 2 delayed antibody-mediated diseases are rheumatic fever and post-strep glomerulonephritis. Right, so here's just like a little thing to summarize the diseases, acute diseases. So in pharyngitis, you're going to have fever, you're going to have painful swallowing, your tonsils are going to be red and swollen and full of pus. This is like classic strep throat symptoms. It also causes impetigo, which causes itchy, honey-colored scabs on the skin. Also can cause erysipelas, which causes warm, painful lesions on the face. Also can cause necrotizing fasciitis, which presents with fever and like dead skin cells in like a small localized area on the skin. Also cause scarlet fever, which obviously causes fever. It presents with a bright red skin rash, and the tongue will feel like sandpaper. The first one, streptococcal pharyngitis. Alright, so This is the classic presentation of strep throat with the red swollen tonsils and pharynx, a purulent exudate on the tonsils, fever, and swollen lymph nodes. And the usual duration of pharyngitis is about 5 days. Okay, we have streptococcal skin infections. We have a lot here to go down. Folliculitis, which would be infection of the hair follicles. You have pyoderma, which is a pustule on the extremities, so your arms or your legs or face that breaks down after 5 days to form thick crusts and heals and leaves a dark area. We have erysipelas, which is an infection of the superficial skin. It only affects the dermis, and it will manifest as a raised red rash. It's only superficial, right? It doesn't go further than the dermis. It also presents with cellulitis, which is red swollen skin, and impetigo, which is a blistered eruption, mostly in children, that becomes crusty and flaky and is usually found around the mouth or oral cavity. Also have necrotizing fasciitis, which is caused by flesh-eating Strep Pyogenes. Not all of them, just specific strains that are called flesh-eating Strep Pyogenes. So these strains have a more virulent M protein, and it follows a break in the skin, moves along the fascia. Patient will begin sweating profusely, become red and hot to the touch. The skin will then change color from red to blue, and large blisters will form. The skin will die, and muscle might become infected, and the muscle infection is termed myositis. Have a specific streptococcus skin infection that the term Fournier's gangrene. It is necrotizing fasciitis that's localized around the male genitalia and perineum. Okay, also scarlet fever. This is a fever that's directly caused by pyrogenic exotoxin. It also causes a scarlet red rash. The rash begins on the trunk and the neck and then spreads to the extremities and spares the face. So it's neck, trunk, not on the face. That's scarlet fever. We also have streptococcal toxic shock syndrome. Right, so toxic shock syndrome. The toxic shock syndrome is also caused by the pyrogenic exotoxin. If you remember, we went back to, it was A and C and not B. Only these two cause toxic shock syndrome. So toxic shock syndrome starts very suddenly and gets bad really quick, right? So the presentation includes fever, headache, malaise, which is like a general bad feeling, sore throat, cough, diarrhea, large rash around the lips, tongues, and whites of the eyes turning red, dizziness, fainting, trouble breathing or dyspnea, and confusion. So these are the four regular diseases that it causes, right? So pharyngitis, skin infection, scarlet fever, streptococcal toxic shock syndrome. So delayed now. So after the patient, after you prescribe antibiotics and the patient sheds the disease, right? You can have a delayed antibody-mediated disease, which is caused by basically the T cells just mounting like this all-out attack after the bacteria is already gone. Okay, so the first one is rheumatic fever. So this usually follows untreated streptococcal pharyngitis, not after skin infection. That's very to know. So if your patient had streptococcal pharyngitis, you can think, okay, maybe he might have rheumatic fever later on, a couple weeks on or a month after, right? So there are 6 major characteristics seen in this disease. That's fever, obviously, because it's rheumatic fever. Myocarditis, which is inflammation around the heart. Chorea. Chorea is uncontrolled movements of the limbs, and this happens usually 2 to 3 weeks after infection. Arthritis, and subcutaneous nodules, and a rash called erythema marginatum. So rheumatic fever is antibody mediated, Antibodies are generated that attack antigens in the heart that are similar to the Strep Pyogenes. Those antibodies cross-react and can cause myocarditis, right? So basically, it's like the same antibodies that your body was creating to attack the Strep Pyogenes. The antigen from the Strep Pyogenes is similar to some structures in your heart. So the antibody can end up causing inflammation in the heart, even though it meant to attack Strep Pyogenes, right? So recurrent infections with bouts of rheumatic fever can cause further damage to the heart, damaging the mitral valve and the aortic valve. So many years later, this can lead to rheumatic valvular heart disease. So rheumatic valvular heart disease doesn't happen all at once. It happens like you've had like a streptococcal, you have pharyngitis over a couple years over and over and over again. It could lead to rheumatic valvular heart disease eventually. Okay, so the joint pain in rheumatic fever is termed acute migratory polyarthritis, which basically means that you could feel the joint pain in your knee at one point, you could feel it in your elbow, you could feel it in your hand, in your toe, like it moves all over the place. The joint pain, not the bacterial exotoxin, just the pain specifically. So unlike the heart valves, there is no permanent damage to the joints from rheumatic fever. And the treatment for a patient with rheumatic fever is prophylactic penicillin therapy for the rest of the patient's life. So like this patient is just very at risk for getting recurrent infections. So he just has to be on penicillin like constantly, which might cause some other problems in terms of his GI tract. Okay, anyways, the second delayed antibody-mediated disease is acute post-streptococcal glomerulonephritis. So this is an antibody-mediated inflammatory disease of the glomeruli of the kidney. It occurs 1 week after infection of the pharynx or skin by a nephrogenic Strep Pyogenes strain. So it's not every Strep Pyogenes strain is going to cause acute post-streptococcal glomerulonephritis. Only certain Strep Pyogenes strain, and specifically the nephrogenic Strep Pyogenes strain. Okay, so the resulting antigen-antibody complex results from induced inflammatory reaction. So this antigen-antibody complex travels and deposits on the glomerular basement membrane, where it can activate the complement cascade, and this can result in glomerular destruction of kidney, right? Because remember, if it's going to lodge in the basement membrane and then trigger the reaction, the white blood cells are going to swarm to your glomerular basement membrane and just try to fight that antibody antigen complex, and in trying to fight that complex is going to end up damaging the glomerular basement membrane and causing kidney disease. So classic presentation that you'll see in clinic with somebody with this disease will be like a kid, and you'll have like a puffy face, like a fatty face, and it looks like it has some fluid in there, some fluid retention, and have dark colored urine. It's said to be Coca-Cola or tea colored, and it's because of hematuria, right? Because the basement membrane is damaged, so it can't keep out red blood cells, and this patient will end up peeing out blood. And you see this, right? So the child may also develop hypertension because of hypervolemia caused by fluid retention. There's something to note. Okay, and this is like a little mnemonic you can use to remember the symptoms of acute rheumatic fever. So these were the rashes, right? And it can be all over, from the trunk, neck, down. So you have joint inflammation, heart damage. You'll hear you might hear heart murmurs because of the mitral valve and the aortic valve getting damaged, right? You have nodules around the elbows, knees, and forearm. You have erythema marginatum or rash. So these are rashes with thick red margins, as you can see here. And you have this Sydenham's chorea, which is shaky movement, right? They look kind of like Parkinson's. You guys know what Parkinson's is, right?
Yeah, when they have excess, shaky. They have a word for this excess shakiness.
I think
Can you
it's still
remember the word?
chorea. I think it's still chorea.
Um, just shaking up. It
Yeah,
affects the
that's
eye too, You have
mm,
we did in optometry. They
okay.
have symptoms with the eye too. I can't go through back these things, yeah.
They get like lazy eye, or is that the
No,
eye
like
just jittery?
with the retina.
Mm-hmm.
Like all disease, you have presentation in the eye. I can't remember what was I'll have to check it up. I'll tell you back. I'll check my book tonight and tell you back
Oh, okay, go
how
go
they
Mark.
present in the eye. Yeah.
You must 5 minute presentation. A joke. 5 minute presentation. Okay. So this is the symptoms for post-streptococcal glomerulonephritis. We had puffy face, right? So facial edema and dark urine, and that's from the blood getting into the urine, right? Because your basement membrane is damaged. And the treatment for Strep Pyogenes is luckily that this strain of strep is not really that resistant to antibiotics. So penicillin works well. Um, if the physician might also prescribe clindamycin to prevent a worsening of symptoms, or to lessen the degree of the symptoms, right? Because remember clindamycin. Wait, before I won't even say it. It's right here. Clindamycin works at the ribosome, right? To stop protein synthesis. So by stopping protein synthesis, you're stopping exotoxin production at the ribosomes, and thus you decrease the duration of disease. So if we have a patient that is allergic to penicillin and he has Strep Pyogenes infection, you can give him cephalosporins instead, such as ceftriaxone. Okay, next one. Put this one down. Yeah, so Strep Pyogenes is the most terrible out of all of these strep. So I think this is the most important one to know. So that's why I did it first, right? Okay, the next one now. So Strep Agalticiae, or also known as Group B strep, right? And I have this picture here, and I'll explain this after. Let me just go through this first. So when you hear Group B strep, you must think of babies, because this strep affect babies, newborns the most. So this strep is actually found in the vagina in about a quarter of women in the vaginal canal. So the newborn baby can contract this infection from vaginal birth. So Strep Agalticiae is a beta hemolytic land-filled group B streptococcus. So it's beta hemolytic, so it destroys red blood cells completely. And it stands for group B because it has group B, C carbohydrate in its cell wall, right? So babies can get infected by this disease during vaginal birth. It can cause neonatal meningitis in babies less than 3 months old. So, something general just to know. If somebody has meningitis, they're going to present with a stiff neck, right? That's an adult. But when a neonate or a newborn baby has meningitis, they won't present with a stiff neck like adults. Instead, they present with non-specific signs such as fever, vomiting, poor feeding, and irritability. So you might think that this baby has a different disease. Maybe you may think this baby has maybe even esophageal atresia, or maybe has some other type of infection. But meningitis also has these symptoms for babies, right? And neonatal meningitis is very dangerous. So it's a very dire situation, and you need to, if you think that the baby might have meningitis, you need to move quickly, right? So you need to perform a lumbar puncture first. Let me separate this. Perform a lumbar puncture first, so you can identify the pathogen, so you can make sure it's group B strep. And then you're going to prescribe antibiotics to cover the 3 known causes of neonatal meningitis after vaginal birth. These are specific to vaginal birth, right? I keep saying vaginal birth because it's very specific to vaginal birth. So these three bacteria that cause neonatal meningitis through vaginal birth are Listeria, E. coli, and group B strep. So all these bacteria are located in the vagina and can cause neonatal meningitis. You can give the baby bacterial infection. Right. Something else to note: there's two other bacteria that can cause neonatal meningitis in babies greater than 3 months of age. But if they're less than 3 months of age, we're going to assume that the bacterial infection is from bacteria that was formed in the vagina. But if the baby is greater than 3 months of age, it could be from somewhere else, right? So these two are Neisseria meningitis and Haemophilus influenzae. And I want to explain. You can look over here. So you can see this baby in the uterus. It's chilling out, and you can see the group B strep in the vagina, in the cervix, and also in the uterus as well. They can be in the amniotic fluid, and so the baby can get this infection as it goes down, right? So group B strep can also infect pregnant women, causing bacteremia and sepsis. And from the mom's bacteremia, the baby can get a secondary infection. So this is not necessarily the baby getting the infection through the vaginal canal, but this could be the baby getting the infection through the umbilicus, right? So a secondary infection of the neonate by this way can cause a stillbirth or a spontaneous abortion. So if the mom gets infected with group B strep, it could end up aborting the baby or resulting in a stillbirth, right? So group B strep can also cause pneumonia and sepsis in non-pregnant adults, and specifically in non-pregnant adults that have diabetes or renal failure or liver failure or stroke, right? Especially in the elderly. Stroke is especially for elderly people over 65 years. So just to recap, group B strep, most important thing, babies. And second most important thing is neonatal meningitis. And it's a very dangerous situation, so you need to act very quickly, right? Right. So group D strep. So these bacteria. So you already went through the A, B, and D's, the Lancefield antigens. So went through Strep Pyogenes up there, B strep and D strep, and these are all the Lancefield antigen strep you need to know. The A, B, D. So these bacteria can be alpha or gamma hemolytic. So either it's going to completely lyse red blood cells, or it's not going to do it at all, right? And it's divided into two groups. So you have the enterococci and the non-enterococci. So one thing I want to note is that nowadays, even like I said it before, like in the bacterial genetics, I think, or the first chapter, is that you have strep, enterococci, and staph. When enterococci is actually a type of strep, but it's considered as a class on its own because it causes a very specific set of diseases and it has a lot of drug resistance, as I'll go down to explain. So the two types of enterococci here are the Strep physalis and Strep physium. And I think that's pretty easy to remember, because then it's an Enterococcus, it's in the GI tract, and you just remember feces, and that's the name of the bacteria, right? And then you have two non-enterococci group B strep, which are Strep bovis and Strep equinus. So these are not part of the GI tract. So, no, that's a lie. These are part of the GI tract, but they don't cause enterococcal infections. I'll get into that. So enterococci live in the intestines. They vary in terms of hemolytic ability. As I said, they either completely lyse red blood cells, or they just don't touch red blood cells at all. They grow well in the bile, in 40% bile, or 6.5% sodium chloride. The Enterococcus causes urinary tract infections, biliary tract infections, bacteremia, and subacute bacterial endocarditis. So you know, it sounds really bad, but normally in normal people like you and me, because it's part of our GI tract, right? If your immune system is working and it's up to scratch, you won't get infected with this. So the enterococci normally prey on the immunosuppressed or the immunocompromised. So we think about immunosuppressed or immunocompromised people, we need to think about HIV patients, we need to think about small children, we need to think about old people, we need to think about people that are on steroids, right? So they normally prey on these type of patient populations, especially in the weak hospitalized patients. And the enterococci are actually responsible, the second most common cause of hospital-acquired infections, also known as nosocomial infections. So in hospitalized patients, enterococci normally causes urinary tract infections, wound infections, prosthetic valve endocarditis, as well as regular endocarditis. I should have put regular here. But like if somebody gets like a valve transplant, it could end up being infected by enterococci. Bacteremia. It also causes sepsis from the IV catheters. Okay. So I have an important note here. Let's see. The Enterococcus is very resistant to most drugs that kill gram-positive bacteria. So penicillin doesn't work, ampicillin doesn't work. They call it the silver bullet, vancomycin, doesn't work either. The vancomycin is like the Superman of the gram-positive antibiotics, because most gram-positives that are resistant to other types of antibiotics, like such as penicillin and cephalosporin and all of those things, they usually be susceptible to vancomycin. But Enterococcus isn't one of those, right? That are susceptible. They believe that Enterococcus acquired resistance to these drugs through a transposon insertion. I should say that cause point mutation. From alanine to lactate substitution. I should say. Okay. There's a transport that causes an alanine to lactate substitution in its peptidoglycan cell wall. So the gram-positive bacteria that normally attack the cell wall will be looking for alanine bond, but that bond has been substituted for alanine lactate bond. So what happens now is that the drug can't break that bond anymore, right? So the drug quinipristine is used for drug-resistant enterococcus instead of all these other drugs. All right, so we also have non-enterococci, and these live in a similar environment to the enterococci and cause similar diseases, right? So the only thing to note about the non-enterococci is Strep bovis. I remember I said Strep bovis and Strep equinus, but Strep equinus is not important. This is what you need to remember. Strep bovis. Let me just put this in bold. So Strep bovis, is its correlation to colon cancer, right? So about a half of patients who get Strep bovis bacteremia will also get colon cancer in their lifetime. So it's something very important to note. So it is unknown if Strep bovis is if it's the cause of the colon cancer, it is just a marker for colon cancer. As we know, correlation does not equal causation, and causation does not equal correlation. So it's just a very strong correlation that's been seen over and over and over again. So it's like a red flag, right? So that's that for the enterococci. We have another Strep Viridans. So Strep Viridans isn't actually like one type of bacteria. It's like a large family of different type of strep. So it's an umbrella term for a huge group of Streptococcus that consists of a mitis group, a salivarius group, a mutans group, and an anginosus group. So I doubt you're gonna have to remember every single Strep Viridans ever, but just something to note that these are the different classes of these groups. So most Strep Viridans are native to the GI tract and the oral nasopharynx. They collectively represent about 30% of culturable bacteria from dental plaque, gingival crevices, the tongue, and the saliva. So this is important strep to know if you are a dentist. Viridis or verde is the Latin for green, and this indicates that Strep Viridans is an alpha hemolytic, as it only partially lyses red blood cells and leaves biliverdin metabolite, which is green. Strep Viridans causes 3 types of diseases. Alright, so we'll go down that and we'll see. First one, dental infections. So some of Strep Viridans, especially Strep mutans, can bind to teeth and ferment sugar to produce acid and cause dental caries or cavities. Okay? So when dental work is done in the mouth, it can send this organism into the bloodstream. This organism can move to the heart and lodge in the heart. It clings to the heart valves via a virulence factor known as extracellular dextran. It will usually attack heart valves that have been damaged before. So, for instance, if you had a Strep Pyogenes infection that caused rheumatic fever, and then you get dental work done, this could happen as well. This could end up causing subacute bacterial endocarditis. So these patients will develop low-grade fever, fatigue, anemia, and heart murmurs secondary to valve destruction. This is a cartoon to show you to jog your memory. So this is Strep Viridans in the teeth. They say you go to the dentist did some serious work on your teeth. Strep Viridans end up going into the bloodstream, and then it can colonize on heart valves. So Viridans, think about Viridans because verde is green, right? So it's like grass and plants and so. Alright. So I just wanted to differentiate subacute bacterial endocarditis from acute endocarditis. Subacute endocarditis, as the name would suggest, isn't as dangerous as acute bacterial endocarditis. And so Strep Viridans can cause subacute. Staphylococcus aureus can cause acute, as well as Strep Pyogenes can cause acute bacterial endocarditis. So they're more dangerous, right? They cause more destruction. So this is Strep Viridans. It's eaten very cleanly. It's like not very gentleman-like, and this stuff is just like ripping things apart. So the last disease that Strep Viridans cause is abscesses. This is more specific to the Anginosus species, this type of Strep Viridans. And the Anginosus species are microaerophilic and are natives of the GIT, the GI tract. They hate oxygen and are often found in the brain or abdominal organs, along with other bacteria that hate oxygen, such as Bacteroides. So this is the last strep, which is Strep pneumococcus. So pneumococcus is a major cause of bacterial pneumonia and meningitis in adults, as well as otitis media in children. Otitis media, also known as middle ear infection. So pneumococcus does not have a Lancefield antigen and is paired as diplococci under the microscope. It has variable hemolytic ability. So based on which pneumococcus you get, it might be beta hemolytic, it might be alpha hemolytic, it might be gamma hemolytic, right? You won't know for sure. That's depending on where it's from and what genetic acquisition is made. So the major virulence factor of pneumococcus is the polysaccharide capsule, and this prevents it from phagocytosis. I don't know if you guys remember this episode of this show that we're watching a long time, but this was the pneumococcus that they're trying to show and how it has these different virulence factors. I think this was supposed to be the polysaccharide capsule. Alright. So immune cells will produce antibodies for the polysaccharide capsule. but there are 84 different serotypes of polysaccharide capsules. So you basically have 84 different types of polysaccharide capsules that any pneumococcus can have. That have one. So if you get infected by one pneumococcus and you produce antibodies for that pneumococcus's polysaccharide capsule, a different pneumococcus can still infect you, right? You're not immune. Okay, so pneumococcal pneumonia presents very suddenly with shaking and chills, high fever, chest pain upon respiration, and shortness of breath. So the alveoli fills with pus from the white blood cells and exudate. Patients will cough up yellow-green sputum or phlegm that when gram stained will be able to identify the pneumococcus. So otitis media or middle ear infection is commonly seen in children with this pathogen. So two other pathogens that cause middle ear infections in children are Haemophilus influenzae and Moraxella catarrhalis. I have to pronounce that properly, but Moraxella. And pneumococcus can also cause meningitis in adults. And meningitis in adults will present with stiff neck. Okay, so there's a note that there is a pneumococcal vaccine that's given to people that is at risk in a hospital, and it's known as Pneumovax, obviously for pneumococcal vaccine, and it covers 23 of the most common polysaccharide capsules, right? But remember there's 84, so it's not covering everything, but it's covering the most common pneumococcus. And it's given to immunocompromised or immunosuppressed patient populations, and remember, you need to remember those type of populations: HIV, old people, children, people on corticosteroids, etc., etc. It's not given to children. Sorry, something else to note, as it has been proven to have low efficacy in children. Okay, so the treatments for strep pneumo. So this is one of these bacteria that have been gaining resistance to penicillin a lot. Like it's currently becoming very drug resistant over the years. So it's resistant to penicillin. It's resistant to penicillin, erythromycin, chloramphenicol, sulfamethoxazole, and the recommended treatment, despite all of these resistance, is high dose penicillin. So you give them, instead of maybe double the dose, triple the dose of penicillin you give normally. Cephalosporins, and if the pneumococcus is especially resistant to like everything else, they will give the silver bullet vancomycin, right? Let's put it here as something in the next decade, maybe none of these drugs will be effective and we'll have another pandemic because of strep pneumo. So that's a possibility, right? So something to think about. And that's basically it, right? So I got questions. So first person on the list is BB. Can you give me the 5 classes of Streptococcus?
5 classes of Streptococcus. I can't remember that, but I can answer the other question.
Okay, you want to pass the question on somebody else?
Yeah, please.
Okay. Who wants to try? Y'all don't be scared, man. We learning.
Strep. Hold on. So we have the pyrogenes. There's one.
Yes, that's one.
Wait, hold on. I see. Pyrogenes. You have the Enterococcus. Well, it's
Enterococcus is under a type of strep.
Yeah, it's under. Oh, it's under type of strep. So you have your pyrogenes. You have your. Where's the new one? We just saw new. The name. Oh
We
my
just did
God.
it a while ago, right?
Yeah, I forget it. Pneumothora.
Pneumococcus.
Pneumococcus.
Okay.
Pneumococcus. What else? So we have the pyrogenes. We have the pneumococcus. We have the strep. I
What about
can't remember the
babies?
rest.
What about babies?
Oh yeah, B. So we have you have the strep. I know you got a strep A, B, C.
So you have group B strep. That's another one.
Yeah, group B strep, group A. You got group A too?
Group A would be
Pyrogenic.
group A would be paginis. Two more.
Is there
Strep.
Strep
I can.
aureus?
Pardon?
Is it Strep aureus or that's Staph
Strep. No,
aureus?
that's staph aureus, not strep aureus.
Okay.
Two more.
Is it staph a group?
Staph is not even strep. Staph is a different species of bacteria altogether.
I can't remember the other rest, but it's just the name. The name hard.
Yeah, I know the names are hard. But remember I told you remember the Lancefield antigens, right? So you have A, B, and D. So those are three right off the bat, right? So you have group A strep, group D strep, group B strep.
And the other two.
And other two now is strep viridans.
Jordans.
And
Expect me to remember though.
But okay. And strep pneumococcus. And strep pneumonia.
Strep pneumococcus.
Right? Or pneumonia.
Okay.
Yeah. Whatever you want to call it. So those are the 5 class streptococcus. Alright.
Oh, okay.
Okay, let's instead of me asking like one person a question, everybody can just chip in. So what 4 diseases does strep pyogenes cause? Give me 4 diseases.
Fever?
What?
Scarlet fever and rheumatic fever.
Scarlet fever. Rheumatic fever would be for the third question.
Pharyngitis.
Pharyngitis, yeah.
Toxic.
Yeah, you got it.
Oh,
Toxic
necrotizing fasciitis.
Yeah, that's right. But necrotizing fasciitis is on the skin infections. So that's the third one, skin infections. And you said toxic. We're finishing it.
Toxic sepsis shock.
Toxic shock syndrome. You're close though. Toxic shock syndrome. So
glomerulonephritis.
Those would be the one.
Oh, there's a 2 delayed. Okay.
Yeah. So scarlet fever, pharyngitis, toxic shock syndrome. What else would it say?
Skin infection.
And skin infection, right? Those are the 4 diseases. So you guys already answered the second question. So the second one would be rheumatic fever. Yeah.
Acute glomerulitis or something like that.
It's post-streptococcal glomerulonephritis, yes.
Right.
Alright, next question. So, can you give me at least 5 virulence factors for strep pyogenes? Everybody can give me one.
M protein is one.
Yes, that's one.
The capsule?
Does it have a capsule?
Oh, sorry.
No, it doesn't have a capsule. That's okay, so I got M protein. The Lancefield group. Remember the Lancefield group antigen?
Oh, that.
So group A antigen.
Okay.
Hemolysis?
Yes, hemolysin. You have 2 hemolysins too, so you can give me one.
Oh, hemolysin alpha and beta.
It's hemolysin O and hemolysin S.
Yes.
Oh.
Okay, so that's 4, right? So give me one more.
M protein.
Streptomycin?
Streptomycin and hemolysin is the same thing. It's just different name for the same virulence factor. You have another one. You have another strepto something. It's an enzyme.
Oh, catalase?
No. Remember, strep doesn't have catalase. Staph has catalase.
Right. Staph, no catalase.
Come on, guys. You can give me what? You guys haven't told me the exotoxin yet. What's the name of the exotoxin?
It's a set of enzyme, man. It's a lot of enzyme, right? But
there's a whole heap of
under
enzyme.
one name. I can't
Wait,
remember the name.
you can give me the exotoxin. What's the exotoxin for pyogenes? Come on. I'm giving you, this is the hint. Pyogenes. What's the exotoxin for pyogenes? What's the name of the exotoxin?
Pyogenes toxin?
Pyrogenic toxin. Yeah, pyrogenic toxin. Easy.
Oh.
Alright. So you could have said streptokinase, you could have said DNAase, you could have said anti-C5A,
Oh,
peptidase,
I know the set of enzymes.
a lot of enzymes. Yeah, this is like strep pyogenes is a lot of virulence factors. But if you remember anything about this, you need to remember the streptolysin OS, M protein, the exotoxin, the pyrogenic exotoxin. Yeah, and I think those are the four probably the most important ones. So, okay, so last question now. Which group D strep is correlated with colon cancer?
Boleus or something like that.
Close.
Boletus.
BO, BO. We can play hangman.
Boletus.
Boletitis.
No. No L.
Bronchitis sound like an information.
Bolia.
R.
R. No,
Boreas.
no R. No R.
Also.
L.
No L.
I'm
No
sure
L.
he said no. X.
X. No X.
S.
No S either. Well, there's a S. There's a S. Like metal.
I guess itis. I think it's an like itis.
They have a I too.
Any T?
T. No T.
V.
Yes, V. So, strep
Oh,
bovis.
Bovis. Oh yes, bovis. It sounds like cow.
Yeah, it's like a. It's
Yeah.
like cow.
Bovine.
And I think it has something to do with the history about the disease, why it's called bovis. I think it was first cultured on cow or something like that. I remember right now. But yeah, so this one, remember if your patient gets bacteremia from strep bovis, they're at a 50% chance that in their lifetime they'll develop colon cancer. I think that's important to know. And that's it.
Okay. So yesterday I was doing some research, right? And I found a holy grail Anki. So I'll send y'all a video. It's called, I don't know if you know about it. It's a big thing right now in step 1 USMLE.
Is Anking met?
Yes, it's Anki.
Yeah, I tried to add it and like it's big, like it keep crashing my computer.
I got it to download. I don't know, it's probably because my internet is a bit fast, but I got it to download and like it's a lot.